Hi, welcome back to Glow Up with Shelly. And today's video is really inspired by all of the pollution there is on the internet, on YouTube, all of the misinformation, all of the people trying to sell you something. So they're telling you things that are blatantly false. I'm clearing all of this up today. So what am I talking about? Well, I recently saw a video by a major skincare influencer who happens to be a physician who was giving extremely false information. And because this person was a physician, I know they know the information that they were giving was blatantly false. I get heated when people tell lies, especially when they know better. So let's talk all about lasers versus microneedling, what they're used for, what their mechanisms are, how they might help you, their cost, because that's a big one, and which one will give you the most bang for your buck, which one will give you the results that you're looking for. Remember, this channel is all about glowing up. Transformative skincare, flawless makeup, and a lifestyle to match. If that resonates with you, hit subscribe. Don't forget to ring the notification bell. I want you to know when I post future videos. So this video was really born out of me seeing another video by another influencer online that was literally like falsehood after falsehood after falsehood about microneedling and lasers, okay? And I'm not gonna call out the person who made the video. You can guess if you want, you can try to find out what you think, but this person was literally lying. And why were they lying? I know they were lying because they're a doctor. And I know any doctor has access to the same information that I have access to. So let's talk about the differences between lasers and microneedling and what you can kind of expect if you do one versus the other. So there are two types of lasers. There are ablative lasers and non-ablative lasers. Non-ablative lasers don't destroy anything on the surface of the skin at all. In fact, non-ablative lasers work by heating the dermis without damaging the epidermis, and through that, they promote wound healing. Sounds kind of familiar, doesn't it? Where do we hear that? Maybe microneedling? So yes, it's a wound healing process, releasing the collagenase and the new fibroblasts and the new collagen structures, right? As the collagen is broken down, right? Then it signals to the body, hey, let's respond, let's go in, let's repair, and let's promote and boost collagen. Ablative lasers work a little bit differently. They're much more aggressive in that they not only heat the underlayer of that dermis, but they also destroy the top layer of the epidermis, right? So you are essentially ablating that off, basically sending the signals to the body, hey, wound repair, wound repair, wound repair. And you get a lot of boosting with ablative lasers because they are so harsh. They are much more aggressive. That's why you tend to see better results with things like ablative lasers than non-ablative lasers. We know that both microneedling and lasers, whether ablative or non-ablative, treat things like scars, age spots, sun damage, fine lines, wrinkles, as well as skin sagging or laxity. All of these treatments can come with some level of side effects. Okay, so is it true that microneedling has absolutely zero peer-reviewed studies? So no, that's not true. There's so many journals that have studies of microneedling in them. There's aesthetic dermatology journals, there's burn wound dermatology journals, there are cosmetic dermatology journals. I mean, there are hundreds of dermatological journals that are peer-reviewed in which studies both on microneedling and on lasers have both been conducted. So don't let anybody tell you otherwise, because that's blatantly false. That is absolutely not true. There are so many journals out there that are peer-reviewed that have studies done on microneedling in which experts have been asked to review the materials submitted to the journal for things like scientific accuracy, for statistical accuracy, for methodological accuracy. So they're really picking apart these articles and looking at them and saying, what are the methods? What are the ways that they measured that, right? Are these accurate? Can we draw the same conclusions based on the science and the data and the methodology? Or would I come to a different conclusion? And they're like the little gatekeepers to that journal. So if they have a problem with whatever you submit, right, they're going to put it back on you and say, you have to fix this or we won't publish you. So there are a few studies that I'd like to share with you in this video before we get into the side effects, because I think that's one of the biggest aspects that you really need to think about in the difference between lasers and microneedling. The side effects and the cost and the downtime. Those are the three aspects you really need to be focusing on when you're focusing on lasers versus microneedling. But I do want to show you, I want to share with you some studies because there are so many really important and great studies that have been done both in microneedling and lasers and comparing microneedling to lasers. By the way, that's happened. I want to talk to you about what they show before we go into the other aspects of microneedling and lasers that you need to consider if you want to do one of these two treatments, possibly. There are so many peer-reviewed studies and meta-analyses. A meta-analysis is when they take several studies and looks at them and compares them for similarities and differences. They might talk about methodology, they'll talk about, conclusions, similarities in conclusions, differences in conclusions, and then usually some kind of analysis at the end, right? This is what we think based on the review of these several studies, and that's a meta-analysis. And the reason why I wanted to explain to you what a peer-reviewed journal was and a meta-analysis is because I think people can be very misleading when they're telling you things. And I get mad too, because I'm like, you're a doctor, you're a esthetician, you should know these things. And I honestly think it comes down to, and I'm gonna talk about it at the end of the video, but I think it comes down to trying to sell people things, right? People want to sell things. And sometimes that can make them dishonest. But let's look at what microneedling treatment showed in the results on both atrophic and hypertrophic scars. Because remember when I told you, I think I told you a little while back when I did another microneedling video, we've done a lot in the past 10 years on scars, right? And the scar studies have shown us how much microneedling benefits other areas too. So the same thing has been done with lasers. So that's what I want to kind of take a deep dive into. From the Aesthetic Surgery Journal, and this is volume 37, issue 1, that's January 2017, if you want to go look this up. It is available. I think it's on PubMed free. I've also heard people tell you don't Google journal articles. You can access journal art. There's a lot of journal articles you can access for free online. There's a lot that you can only get the abstracts from. Okay, but you can access a lot online. You can get the abstracts. I have access to a lot of journals because I used to be a college professor, so I actually do have access to a lot of databases that have several journals, so I don't have to worry about just going to Google and trying to search Google and getting a bunch of abstracts. I can actually look at the journal articles themselves too. So this one was about microneedling depth penetration and the presence of pigment particles. Now, what I thought was interesting at this study, it looked at the depth of and accuracy of in-office microneedling. It also looked at how much time post-treatment that you had to apply like serums, for safety and efficacy. They use like 6 different needle lengths. So they use 0.25 all the way up to 2.5 millimeters. So those large needles, right? That's a lot of length in your face, right? And what was interesting about it, one of the conclusions they came is that they all showed improvements in wrinkles, skin laxity, scars, and just the overall appearance of the skin. The side effects from this study were extremely minimal, and in fact, no side effects were mentioned at all in the study. In this journal article, it talks about how patients treated at the center demonstrated statistically significant improvements in wrinkle effacement, skin laxity, scar softening, and hair growth by patient and observer satisfaction scores at 12 months. In all of the studies that I've seen on microneedling, right, we definitely see that there were always statistically significant changes in the skin. And I've seen this in article after article after article. There are statistical significant changes to the skin, whether that's the thickness of the skin, the tightness of the skin or firmness of the skin, wrinkle depth and size, as well as fine line improvement, and hair growth as well has also been studied with microneedling too. So that's just one study. And the reason I wanted to cite this study is because I, again, have seen people say blatantly there are no studies, peer-reviewed journals that show a statistical significance in skin changes from microneedling. That is absolutely untrue. There are tons. So let's compare then, let's step back and compare microneedling to lasers. So in all of the literature, and I reviewed tons of journal articles on lasers as well as needling, and both comparing lasers and needling. And what I found was that lasers are so much more precise. And that's why I wanted to point out this article from the Aesthetic Surgery Journal, because one of the things that it demonstrated was that needles, when they were inserted at depths of above 1 millimeter to all the way up to 2.5 millimeters, which is what they ended the study on, the precision of that needling was less precise, essentially, right? As you get up into higher needling depths, you get less precision. There's a little bit more mechanistic, I guess you could call that, components to a pen than there are to a laser. Lasers are definitely more precise than microneedling. Lasers have shown extremely promising results in scar revision, skin laxity, and in wrinkles, etc. So they show a ton of promise and have shown to reverse a lot of, your sun damage, skin damage, just like microneedling. So that being said, lasers also come with a whole host of side effects. That's where I think lasers can be a little misleading. They tend to cause more hyperpigmentation, than microneedling. They tend to also cause more post-inflammation. So they cause more inflammation and edema in the skin, so swelling. So you're gonna get a lot of swelling after a laser. Interestingly enough, that video I saw said you're gonna only see swelling with microneedling. You will also see swelling with lasers. You will see edema with lasers, and it will last for several days. Both in ablative and non-ablative lasers, ablative especially, because they're going to be scorching off that outer layer of your skin near epidermis. And so you're going to get a lot of edema and you're going to get a lot of downtime. Now with non-ablative lasers, you don't have any downtime, but you really just don't see the big bang like you do with ablative lasers. They don't tend to increase collagen as much as ablative lasers. They don't help with skin laxity as much as ablative lasers. So ablative lasers are just a little bit more aggressive because in addition to heating up that underlying tissue in the dermis, it also heats up the epidermis, right? And so you're going to get, it also sears off that epidermis. So you're going to get it's going to be like a new skin being formed on the outside, right? And underneath at the same time. So it's very aggressive. There is a lengthy downtime. It's usually about a week to 2 weeks that you're going to be struggling with this. I think after for ablative lasers, the first 5 days, you're not going to do anything, right? And then after that, you can start to resume some of your normal activities, but they're very aggressive and they're very painful. And lots of patients have tons of stuff with ablative lasers. With ablative lasers, you can have scarring if it's not done properly. You can have lots of swelling, edema, bruising, and usually the bruising, things like that are temporary. You can also have, just like any other treatment, like a chemical peel, you can have purging of underlying acne under the surface of the skin. You can more seriously get an infection, whether that's bacterial, viral, or fungal, just the way lasers work, both ablative and non-ablative. That's more toward ablative because you're burning off, remember that would make your whole face an open wound, which is very easy to get bacteria, viruses, all of that into it. You can also get changes in skin color. And this is where some of the problems with lasers have really played out. So when you're trying to figure out like which one works better, lasers or microneedling, really that kind of depends on the study that you're looking at, because some of the earlier studies, like I said, showed tons of improvement in the skin. And in some of those studies, they have shown that lasers are superior. But interestingly enough, a lot of those studies actually come from the laser manufacturers themselves. So I want to share with you a study that was in the journal, February 2023 Journal of Lasers and Medical Science. And it's a systematic review of the comparison between needling, RF needling, mesoneedling, and microneedling, and ablative fractional lasers, CO2, and erbium-YAG in the treatment of atrophic and hypertrophic scars. And erbium-YAG is kind of a newer laser, and it's a really interesting laser because it's one of the lasers that is like most friendly to people with darker skin. People who have like darker skin tones, who are browner, or, you know, have more melanin in their skin, don't tend to react to lasers very well. They tend to get a lot of pigmentation, post-pigmentation. This is true also of people who, like Asians, who have kind of that medium toned skin, tend to also have a lot of post-inflammatory hyperpigmentation because of lasers. And peels can also cause post-inflammatory hyperpigmentation in a lot of Asians. And depending on how you react to the treatment, you know, the laser treatment itself. But what this found, and I'd like to read this to you because I thought it was so interesting, is it was a meta-analysis. There was no statistical significant difference between the two methods, laser and microneedling, in the treatment of atrophic and hypertrophic scars in 60% of the articles studied. So you didn't see a statistical significant difference in how they boosted collagen or boosted elastin or restructured collagen fibers in 60% of those articles, right? Both showed significant improvement, 70% or more improvement to complete response. So that was pretty good. Significant improvement was noted in 20% of the studies reviewed for the laser and microneedling treatment methods. The results of the study show that needling and ablative fractional lasers are tolerable and safe procedures with no significant difference in the treatment of skin scars in 60% of the studies. So 60% showed no statistical difference. And that's huge, right? Because I don't care what anyone tells you, microneedling does not tend to cause post-inflammatory hyperpigmentation. Can you get it post-microneedling? Yes, you can if you have certain skin types, if you're more prone to it, if you have a skin disorder, you can get it. You're going to have a bigger chance of getting post-inflammatory hyperpigmentation if you use a laser versus microneedling. And that is just the facts, guys. If you look at all these studies, that's what they show. If we don't see any statistically significant difference between lasers and microneedling in most of these studies, right? We do see something else happening in most of these studies, and that is that people have side effects more often from lasers than they do from microneedling. Study after study that I looked at, there's more side effects from lasers than there are from microneedling. That's just a fact. There's another study, and this is out of a journal in India. It is the efficacy of microneedling and CO2 lasers for acne scar remodeling, a comprehensive review and being done on CO2 lasers and microneedling. And what it demonstrated, right, was that CO2 lasers, ablative CO2 lasers, had a slightly more statistical significant difference in collagen induction. And they don't know why. That means that there was a little bit more collagen repairing going on with the laser versus the microneedling. But it's crucial to note that At the end of the study, what they found out was that lasers and microneedling both work to repair atrophic and hypertrophic scars. So I thought that was really interesting because both had a statistical significance. So even when they looked at the studies side by side, they both had a statistical significance in their impact on scar revision. But CO2 lasers did show a little bit more promise. What y'all have to remember is when you microneedle, right, you're back up in 5 days. You go get CO2 laser done on your face, you can be out for a couple weeks, okay? So it's much more aggressive. So the fact that there was only a slight increase with CO2 lasers, to me says microneedling is pretty darn good. Now, does that mean that there's never a place for lasers? No, lasers have so many benefits. I love lasers personally. I've had laser treatments done at my Medi Spa, and I love my laser treatments. But let me tell y'all something, lasers are not cheap at all. They are expensive. Not only that, you can't do it at home. It is way too hard. That is one thing that they get right. The fans of lasers, not everyone can do them. They are, you do need a physician or somebody trained like a nurse to do the treatment for you. You do not want to do this on yourself. You would not know how to do it. So when you're talking about ablative versus non-ablative lasers are not going to have much downtime at all, if any. You may have some slight redness, you may have itching, you may have some pain, you may have some purging of underlying acne, but you really won't have, you could get an infection. There are things that can happen, but it's very rare. You're not really gonna have a lot of side effects with non-ablative lasers, okay? You're not, but you are gonna see collagen come up. You're gonna see skin tightening. You're gonna see wrinkles diminish. You're gonna see scars, become more even, just like with microneedling. And with non-ablative lasers, since they're not as strong as your fractional CO2 lasers, your ablative lasers, right? You're not gonna see as much of a boost in collagen, okay? So it's not gonna be as significant as an ablative laser. Let's look at the price of non-ablative lasers because, woo baby. At my Medi Spa, one treatment will set you back $1,100. $1,100 for one treatment. One treatment of microneedling at my Medi Spa will set you back $300. So lasers are just a lot more expensive. The treatments are much more expensive. Now, if you're doing something like IPL, okay, which can also boost collagen. It can get rid of hyperpigmentation, redness. I had IPL done on my face and I loved it. I had 2 sessions of IPL, absolutely loved it. It got rid of my rosacea like permanently. I think I have one little vein right here, but you can't see it with makeup on, but that's it. Like, so I can wear, like I used to not even want to not go without makeup, which I don't like going without makeup anyway. But I used to hate to do it because of that rosacea spot, and the IPL got rid of it completely. Also, I did it around my nose and it got rid of a lot of the redness around my nose. And one session of IPL cost me $400 at my Medi Spa. Okay, so that's the kind of difference that you see. IPL is super, it's a non-ablative laser, but it's like very minimal laser. That session runs about $400. Microneedling session is going to run you about $300, and a non-ablative laser session is going to run you about $1,100. These are quoting exact prices from my Medi Spa. Now, how much will a CO2 laser, fractional laser, cost you? You are looking at anywhere from $2,500 to $3,600 for one session. It is really expensive, okay? So I think there's a push, definitely, if you are a practitioner, you're gonna wanna sell lasers way over microneedling. Why would you even wanna carry microneedling? Why? Because if they can't sell you lasers, they're gonna sell you microneedling. That's why. That's why medi spas have all the things they have, right? If they're not going to sell you one thing, they're going to sell you something else, because there's always something at every price point that works for you. So let's get into lasers versus non-lasers. So ablative lasers, so now that we know the price, right? And we know why people might be motivated to sell lasers, right? Because it's more expensive, right? One treatment's gonna cost you $1,100 for a non-ablative laser. That's a lot. And you're gonna need, just like microneedling, you're gonna need more than one session. I'm not kidding, like you really will. They sell these in packages too, right? They sell them in 1 to 3 session packages for non-ablative lasers. And they're expensive. At my medi spa, it's $3,000, $3,000 for a 3 session non-ablative laser. And that's what they suggested when I asked them what they would suggest for scar revision. They said, well, you could do either the laser or the microneedling. Lasers may work a little bit better. You might see a bigger boost in collagen, but they're gonna set you back, you know, $3,000. Or you could do microneedling. You're gonna see a boost in collagen. You're gonna see a revision of your scars, and that's gonna set you back $900. So do you see the difference, right? Lasers are more expensive. Now, whether or not a non-ablative laser works as well as a microneedling session, I can't tell you specifically, right? Because most of the studies have shown there's not a huge statistical significance between non-ablative lasers and microneedling. That has been demonstrated in a lot of studies. Okay, so I can't tell you which one will work the best. I do know that if you're really wanting scar revision and you really want skin tightening, your ablative, the CO2 laser, is going to be amazing for you. However, you may see there may be side effects, so you have to keep those in mind. If you have darker skin tone, you might not want to do an ablative laser. If you are suffering from some kind of skin disorder or autoimmune disease, you're not going to want to do an ablative laser. It's just too aggressive. So if you have an autoimmune condition, you're going to want to be careful with lasers. You're really going to want to work very closely with your practitioner. If you're taking any acne medication, you wouldn't want to do lasers. If you have a history of keloid scars, you won't want to do that. Understand that lasers do come with more side effects than microneedling. Remember, I say that microneedling is not for everyone either, right? If you have a history of diabetes, if you have an autoimmune condition, if you're taking acne medication, if you have a history of keloid scars, so it's kind of the same things, right? But you can do it if you have darker pigment, as long as you don't have a history of post-inflammatory hyperpigmentation. And if you do, you need to work with a medical professional and at least get some tretinoin, some vitamin A, and some hydroquinone to use afterwards so that you can get rid of any of that post-inflammatory hyperpigmentation that may be a result of it. And the same you could do with lasers. However, lasers actually have been shown to do something very different than just post-inflammatory hyperpigmentation, and that is that they can actually darken the skin. And so that's where I would make sure that you're working really closely with your medical provider and making sure that you're the type of person who can have this treatment, because you do not want dark patches on your skin that do not go away. You do not want that. That is my advice to you. So this is why I believe that people will mislead you and say, oh, you know, lasers are better than microneedling. Microneedling is inferior. There are no studies that are done on microneedling. The reason they'll say these things is because, right, lasers are a lot more expensive. and if you're operating a medi spa or any kind of practice, right, you're going to want your patients to choose lasers well over microneedling. Can just about anyone do microneedling? Yes. If you are an esthetician, in my state, you have to be an esthetician in order to do microneedling. I think in this state, cosmetologists can do microneedling as well, but you have to have a license of some kind. Whereas a laser, you have to be a medical professional of some kind, or you have to be trained on it in order to do the laser as well. What are my conclusions from this whole video that I've just done, which is tremendously long now? My conclusions are that they both are very effective for skin regeneration, for scar tissue revision, and for wrinkling, for skin laxity and for collagen synthesis and regeneration. So both are great, okay? I do think there are I think microneedling is easier to do at home. You can do it, right? That's pretty scary for anybody who runs a med spa, right? You don't want people running around doing their own treatment. But the truth is microneedling can be done at home, right? And it can be done effectively at home. And so that saves you some money. Lasers are going to be expensive, right? They're going to have, depending on if you do ablative or non-ablative, the ablative is going to have more downtime. The non-ablative, not so much. You will have some swelling, just like microneedling afterward. But the cost is really kind of where I'm honing in on the difference between these two procedures. They're still quite expensive in relation to a microneedling procedure, especially one done at home, right? So $1,100 versus $30. So you've got quite a huge gap, right? So you could do microneedling more on yourself than you can have it done in a spa. But even if you had it done in a spa, the price comparative, it's just going to cost you more to do lasers than it will at all to do microneedling. That doesn't mean they have a place. If you have really deep scars, your pitted boxcar scars, you're going to really want probably to do lasers and microneedling. Okay, I think there's room for both. I really do. I don't want to discount lasers. I don't want you to get the message in this video that lasers are bad, because lasers are not bad. Lasers are great. There's a lot of good things about lasers, but lasers are also not the end all be all. Okay, and they're not so much more effective than microneedling. No, sir. That is not true. They both help with all of the things that I mentioned. So you can do those interchangeably, right? You don't have to do them both. But if you have extreme scarring, you may need to do those both. If you have other issues that lasers work on, you might need to do both of them, right? I think they both have a place. And if you're looking for a fast, quick, fix, right? The ablative laser is amazing. I'm talking instant, right? But you're going to have a lot of downtime for that. And you won't be able to do it once a month like you can microneedling. So there are lots of things to consider when you're considering both of these. If you want something that's a big, quick bang for your buck, and you don't have darker skin and you don't have certain conditions and all the things, you could probably do ablative lasering, and you're going to see a huge difference in your scarring immediately after one session. But you could probably also do 6 sessions of microneedling, right? And get a huge return on your scar regeneration as well. Okay, just something to think about, because I think we need to understand that when I'm talking microneedling, I mean regular microneedling. So using these treatments to repair your skin and regenerate it and get it back to where it should have been in the first place had we taken care of it all of our lives, right? Or getting it back to where it was before it was scarred up, right? And that does take time. I really want you to think about, when you're looking at these two procedures, which one makes most sense for me, right? Not just which one is an influencer selling you or someone trying to tout or, tell you, go out and get this, go out and get this. This is what you want to do. This is what I recommend. Think about what is best for you. Understand that there's no one procedure that fits everybody, and they all have their benefits and their drawbacks as well. Every procedure does. One thing about microneedling is it is cheap. Okay, you can do it at home. You can do it yourself, and you can do it once a month, and it can make huge differences to your skin. Lasers, however, you're going to have to go to a medi-spa. You're going to have to pay somebody. You're going to have to take time out of your schedule. You're going to have to go there. You're going to have to get the session done. You're going to have to take time to recover. They both have peer-reviewed studies, and they both have been studied at length. And there's even more studies coming out daily, and they're in peer-reviewed journals. There you have it. I wanted to really address this because I was one of the things is I was angry. I was angry that people were being lied to, because I guess I don't like it. I'm an educator. I cannot help it. I am not somebody who's good at selling things. I never have been. I don't like selling things. I also don't like being disingenuous. And I will never be disingenuous on this channel. I believe that an honest person can be on YouTube. I really do. Although I don't have very many followers, so I'm not sure if that's the case. But I do believe that honesty can be in this space. And I want to bring honesty to this space because I think too many people are trying to sell things. And that is not my goal. Do I find products that I like? Yes. Will I share them with you? Of course. But 9 times out of 10, I'm not trying to sell you something. I'm really not. I do have, a storefront. I have affiliate things but I only back the things I really do like. And I don't do it for personal motivation. And I think you need to be aware that there are people out there who will try to mislead you. So I hope you gather information, get all of the resources possible, and try to find out the truth and try to find a way to get the best skin you can for the least amount of money. I don't want you to be paying $1,100 for a treatment that you don't need. So leave a comment in the comment box. Do you like this video? Do you want more like it? What else can I do for you? Have you tried lasers? Have you tried microneedling? Which one do you like the best? And I'll see you next time on Glow with Shelley.